Welcome, everybody, to this webinar on trends and signs of drug use in adolescents. Just so you all know, my name is Lindsay Behrens. I am a certified alcohol and drug counselor. Don't worry, I'm not going to go through this whole bio of information, but just a couple of key things. I work at Evolve Adolescent Behavioral Health. I have a dual position with the company. So I am the program coordinator to Evolve's virtual program, which is a PHP IOP program. And then I'm also the substance use recovery manager for the company. And in that role, I provide training, consultation, and development for staff. And then I also offer specific recovery support to clients at the RTC, PHP, and IOP levels of care that come in with a history of substance use or substance use diagnoses. So, a couple of key takeaways that I'm hoping you guys are going to walk away from this presentation with is really just the ability to identify current substance use trends in adolescents, the ability to identify common warning signs of substance use in adolescents, and also discover effective ways to intervene if your teen exhibits warning signs. So one of the things about substance use trends when we're talking about them is that they're constantly changing. Substances that were maybe on the rise 10 years ago might not, or even 3 years ago, might not be the ones that are currently so prevalent. And also just the substances themselves have changed so much over the years. But knowing current drug trends can really help especially parents and caregivers, but really everyone to really know what's out there. Because if we know what's out there, then we can be better prepared on how to deal with them. So we're going to start with some general statistics, and then we're going to dive into a little bit more details throughout the presentation. So some overall stats. Okay, so according to the National Institute on Drug Addiction, also known as NIDA, there was this dramatic decrease in substance use reported in adolescents from 2019 to 2020. And since then, the numbers have kind of continued to stay below what we would call pre-pandemic levels, pre-2019 levels. And in addition to that, we're also seeing an increase in adolescents reporting abstaining from substances such as marijuana, alcohol, nicotine. So that's something that can be really useful for parents and caregivers to know, because a lot of times our teens come in and it can really feel for them that everyone's doing it. It's everywhere, everyone does it. And so it's kind of helpful to know that when we actually look at the data, the numbers tell us something different, that a lot more teens are choosing to not use substances or to not use substances regularly. And those are some pretty positive trends overall. But at the same time, there's also statistics that are showing that, unfortunately, the fatality rates related to substance use continue to increase. So that's concerning, right? Because we're seeing this discrepancy. Like, on the one hand, we're seeing, okay, there's less use occurring, but there's more risk of fatality. And when we look at why that is, a lot of the research is showing that that's due to fentanyl. So fentanyl, for those of you who might not be aware, it's a synthetic opioid. It is about 50 times stronger than heroin and about 100 times stronger than morphine. And one of the big concerns with fentanyl, besides how potent it is that it's being found in so many other substances. And I'm not just talking about some substances that you might assume, like heroin and opiates, which is true, it is being found in those, but it's also being found in other counterfeit pills, like even Xanax, or stimulants such as cocaine, and even MDMA, which is also known as ecstasy. So that combination is pretty dangerous, especially when we're looking at adolescents, because you can have a teen who might feel like they're being smart about it. They might come in and talk about, like, oh yeah, well, I know that fentanyl is really dangerous. I know it's really bad. I wouldn't use that, right? but they're not as aware that increasingly it's being found in other substances and that they could end up experiencing some of the very serious consequences of fentanyl use without intentionally taking it. So, and to be honest, that's something we've had a lot. Worked with a lot of teens, especially that come into Evolve, who've had experiences like that, where they did not know that they were ingesting fentanyl. They weren't doing it intentionally, but that is what happened. So ultimately, it's just that the stakes are a lot higher for this generation, even when we're talking about experimentation and not even regular substance use. So when we're looking at specific trends, and some of these might not be a surprise to you, this is what we're kind of looking at. So today we're going to be talking about nicotine, specifically nicotine vaping and nicotine pouches, cannabis and cannabis vaping, and then hallucinogens, specifically looking at mushrooms, also known as shrooms, and microdosing. So let's start with nicotine. Okay, so nicotine can be found in a lot of products, pretty much any tobacco product, but it can also be found in other things such as nicotine vapes and nicotine pouches, which we are going to go over. But I want to direct your guys' attention here to this slide. So the National Youth Tobacco Survey indicates that 12.6% of high school students and about 6.6% of middle school students report current use of any tobacco product. Okay. And when we look here, we see that about 2.1 million youths are currently using e-cigarettes. About 1 in 4 are reporting that they're using daily, and about 9 out of 10 of them are reporting that they're using flavored e-cigarettes. And that's something we're going to be touching on later. So this is one of the main reasons, though, I really want to talk about nicotine vaping, because the data shows us that this is the most common way that adolescents are using nicotine. Okay, so here are a few different pictures of different generations of nicotine vapes. And one of the main reasons that I'm pulling this up is just so that you can kind of familiarize yourself with the different devices and know which ones might be most popular with the adolescent population. So if you start over here, this was like the first generation of e-cigarette. It was a disposable cigarette. It was meant to mimic the look of a regular cigarette. Eventually, that kind of shifted to these vape pens. They became rechargeable. The cartridges in vape pens and the cartridge, let me see if here you go, is going to be this part right here. Okay, so the cartridge could either be disposable, which means you would unscrew it and you would throw it away, or they could be refillable, which means you don't toss the cartridge, but you refill it with a substance. Then we kind of move to these mods or tank devices. I'm sure you guys can tell just by looking at the picture, these are a lot bigger. They're a lot bulkier. One thing that makes it more or appeals to people who smoke regularly is because they're a little bit more customizable. But I will say that this is not one that we typically see as much with the teen population, because I mean, that's not discreet. And typically most teens are trying to be discreet when they're using these devices. So when we are talking about, okay, well, then what ones are the ones we're going to be keeping an eye out for that we do see more often? And that's going to be these two right here. Okay, so pod-based devices, these can they come in different shapes, come in different sizes. Similar idea with the cartridge that's inside can either be disposable or refillable. But the ones that are going to be the most, so this is popular amongst youths, but I'd say the one that is the most popular is going to be the single-use disposable vapes. Okay, so that's kind of a mix between pricing and also because they are flavored. And that is going to be a very big theme here that you're going to see. But the fact that they are flavored makes them really, really popular around, among the teen population. And actually in 2020, the FDA actually restricted flavored cartridges for these pod-based devices due to the concern that it was being marketed towards youths and that it was like encouraging use amongst youths, which the research did kind of support that. But the problem was that it did not apply to these single-use disposable vapes. So although they were required to stop selling the flavors here, not here. So then we saw this big spike in teens using that. And even if we go back to the last slide, we see that, right? The ones that are the disposables that allow them to have flavoring, those ones are going to be most popular. So another type of vape that I just want to mention are smart vapes. So smart vapes have some type of screen. Now, some of them can be very basic that just have maybe like the puff count or the battery. But the problem is that the smart technology is increasing so quickly that it's hard to not feel like it's being marketed towards youths, just as there was a lot of indicators that the flavored nicotine was being marketed towards youth. So for example, now we're noticing that the screens on these smart vapes are getting bigger. Some of these have, you can tell here, game capabilities, like where you can play like Tetris and Pac-Man and things of that nature. So I think some of them even allow for like puff competitions where you can see rankings on boards. So it's really concerning when you think about this. And also it's hard to not feel as though that this is being marketed towards a very specific population and a younger demographic. So in addition to the vapes, another nicotine product that's really grown in popularity with adolescents is going to be nicotine pouches. So nicotine pouches are these small white pouches that are typically placed between the lip and the gum, kind of similar to how chewing tobacco would be. But with the nicotine vapes, you actually don't have to spit as you would with chewing tobacco. So that's one of the reasons why it's more popular. Also, there's no smell, there's no smoke like there would be with something like a vape or smoking of nicotine. And also, common theme, they're flavored. Okay, so these have really been gaining in popularity over the last couple of years. I think the research showed that from 2021 to 2023, use of nicotine pouches almost doubled. So although nicotine pouches are kind of marketed as tobacco and smoke free and kind of a way to help people stop smoking cigarettes, when we look at the demographics of who's really using nicotine pouches, it's really showing that it's popular amongst the youth population. And one of the top brands is Zen. And I will add, there are some pouches out there that actually do have nicotine and tobacco. This is an example of one that's just straight nicotine. But yeah, Zyn is a really popular nicotine pouch brand. There's also a lot of slang for Zyn. So I would say, you know, for parents and guardians, if you're hearing things like Zinning, Zimbabwe, Zinfluencers, which was like a name that influencers who were promoting Zyn were being called, then that's something to just keep an eye out for. Okay, so then moving on to cannabis. So with cannabis, it can include a really wide range of products, but within the cannabis plant, there's going to be different what's called cannabinoids. And two most common are either going to be THC or CBD. And THC is the psychoactive cannabinoid that kind of gives that high. And usually when we're talking about cannabis in this type of setting, we're typically referring to cannabis products with THC. So in 2022, marijuana was the most commonly used illicit substance by adolescents aged 12 to 17. In 2022, there was about 30.7% of 12th graders that reported using cannabis in the past year, and about 6.3 reporting using it daily in the past 30 days. And something to be mindful of when we're talking about cannabis is that the potency can really vary based on the THC product. And this is really important because it's not uncommon for a lot of parents or guardians or just people in general to kind of have certain thoughts like, well, you know, I smoked weed when I was younger. I knew people that smoked and it wasn't, it wasn't that big of a deal. It didn't cause any big concern. And that's actually something we hear from a lot of our teens coming into like, oh, well, it's natural. It's a plant. My parents did it. It's not a big deal. And so I really kind of want to just take a second to put it into perspective because I can understand how people can feel that way. And also I think it's important to kind of look at some of the facts. So THC in flower, and when I say the flower, I mean like the plant itself. That in the 90s had maybe about, I think on average, the potency was about 3 to 4%. And then in the 2000s, it increased, I think it was more around 7% for average potency. And now, when we look at the potency of the flower, we're looking at on average 15 to 25% in potency. So that's almost, 4 times the amount of what it had been in the past. And when we look at concentrates, THC concentrates, we're looking at potencies between 60 to 90 to sometimes even 95 or even higher percent. That's a really big contrast. Okay, so this increased potency shows that this is not the same cannabis that was around in the past, right? So although I can understand people being like, oh, well, for me, it wasn't that big of a deal when I was younger. It's not the same thing anymore. It's really, really not. So I think that's just an important thing to be mindful of. THC can be taken through a lot of different forms and can be found in a lot of different products. So I have kind of 4 main areas. We have the flower or the plant. We have different types of extracts or concentrates. We have tinctures and we have edibles. Current trends do show that these are going to be the 2 most commonly used. But when we're talking about specifically vaping, that we're looking at these extracts and we're looking at these concentrates. And that's the one that I do want to take a moment to kind of focus on. So here are some examples of different THC concentrates. Concentrates are inhaled by either vaping or dabbing. So vaping, they're actually going to look very similar, almost identical actually, to the other devices that I showed before. Actually, I can go back to it. So the devices are going to look pretty much the same. It's just that the substance that's going to be in the cartridges, even disposable cartridges, is going to be THC versus cannabis. So, and then the other way is going to be dabbing. Dabbing, they're specific devices used for smoking concentrates. They need to be heated at really high levels, but they're going to look similar to like pipes or bongs. And one of the main reasons why I'm showing you guys this is just to kind of really highlight that cannabis products aren't just marijuana anymore. It's not just the flower itself. Some people don't even realize how many different forms cannabis can take. And so it can be also a lot harder for parents to spot or to know what to keep an eye out for. So now when we're talking about vaping, though, you're going to be looking at these oils. So a couple of stats about cannabis vaping. So in 2022, about 6.5% of 8th graders, 13.1% of 10th graders, and 19.6% of 12th graders reported vaping cannabis within the last year. Vaping is the second most common way that adolescents use cannabis. The first is going to be by smoking the flower. And that given the potency of THC concentrates, there is an increased potential for adverse side effects related to cannabis use. So, side effects could, of course, be anything from having red eyes or being more hungry or being more thirsty, but they can actually end up leading to other things as well, like increased anxiety, increased paranoia. For individuals who are smoking a lot, or maybe potentially have a substance use disorder, cannabis use disorder, you might end up seeing something called CHS, which is cannabinoid hypermensis syndrome. That has to do with increased nausea and vomiting and abdominal pain. There's also been reports of individuals developing psychotic symptoms as a result to these really high levels of THC potency. So, and this is something that teens are especially at risk of developing due to their developing brains. So they're really more at risk for these side effects. And also we know too that there's an increased risk of developing substance use disorders as well, the younger that someone uses a substance. Okay, so now we're going to kind of shift to hallucinogens. So hallucinogens are a class of drug that they cause changes in someone's perception. They can change how someone is thinking, how their thought, their emotions. There are different types of hallucinogens. We're going to be really looking at psilocybin, which is also known as mushrooms or shrooms. This is a classic hallucinogen, and they can be taken by themselves. They can be put in teas or food. But from 2018 to 2021, non-LSD hallucinogens increased in prevalence from 3.4% to 6.6%. So essentially, it doubled. So the reason why I put it here, even though technically it's not one of the most commonly used substances overall, it's because the interest in shrooms continues to grow. And the fact that it's doubled in recent years shows this increasing trend, especially when we compare it to the decreasing trends of other substances or the stable trends of other substances. And when we're talking about shrooms, one of the most popular ways that people and adolescents have been taking them is through something called microdosing. And microdosing is a very big topic of discussion these days. So a microdose is going to be when someone takes small amounts of a substance to get some of the physiological symptoms without experiencing a full psychedelic experience, or maybe some of the potential unpleasant side effects that you might get from a full dose. Most of the time when people are talking about microdosing, they're talking about shrooms or LSD, but this can be done with many substances, including cannabis. But in recent years, there's really been this kind of growing interest in the potential benefits of certain hallucinogens, including shrooms, and how they might indicate some benefits for improving mental health. So there's been this really growing fascination, but that's really actually been pretty concerning for that teen population, because what's happening, and I have this happen a lot, I'm getting teens coming into sessions and they're hearing general information that this might have some benefits, but they're really not informed about the full picture. They're not understanding that the studies that are being done are in very controlled environments. They're under medical advisement. They consider an individual's history on if they're even would be appropriate to participate in these trials. So even the studies that are happening that might indicate potential benefits, it's not the same as an adolescent going and buying shrooms and self-administering what they think a microdose is, or as a way to help them with their depression or anxiety. But we'll hear a lot of teens coming in being like, oh, well, I'm just microdosing, it's going to help with my depression. Right. And the reality is there's just like not enough information to indicate effectiveness overall, but especially when we're talking about the adolescent population. So a lot of times when we talk about paraphernalia, you might think of joints or bongs and pipes, and those are all very true. I just wanted to put a couple up here that maybe you don't think about as commonly. So here we have, little plastic baggies, looking out for any kind of like empty containers. These are typically used for like to hold especially if we're talking about cannabis, more of the flower, and these ones typically are for those concentrates that we were talking about. Any kind of torch like this, that's something that would be needed if someone was dabbing, because again, it needs to be heated at that really high heat, as well as other substances as well. Now, Q-tips. I know this is one like, what? So Q-tips is one of those things that's really commonly used to clean devices. So if you're seeing a lot of Q-tips around, if you're noticing a lot of Q-tips missing, that's something that definitely would put a little an alert out for me. And then I also have some cleaning supplies here. Now, these are specific ones that are meant for cleaning certain paraphernalia. Typically, what we would see more with adolescents is using household products like rubbing alcohol or Epsom salts. But the reason why I put this here also is because I really want to point out the numbers here. So 420 is like a number that's always had this association with cannabis smoking. It's sort of like a code word slang for smoking cannabis. But also there's a new one, which is 710. And if you take a look at it, you'll see that this is, if you flip it upside down, it's oil upside down. So now in addition to the 420, you see 710. So if you're seeing a lot of like those numbers written places, if you see your teens writing them, or if they're putting them on their backpack or anything like that, that would be something to keep an eye out for. Okay, so now we're going to kind of shift a little bit to talk a little bit more about signs of substance use. So substance use in teens can be a really challenging topic because on the one hand, we know just how risky and concerning substance use in adolescence can be. And on the other hand, we also know that a really big normal part of adolescent development is risk taking. And sometimes there may be instances where that risk might involve experimental substance use. Now, I want to be really clear that that does not mean that we need to minimize or that we need to excuse substance use. Rather, the way I look at it is that since this is something that's going to be a part of society, and since there's going to be this natural desire for teens to want to experiment or even to just be curious about substances, you know, like wonder about them, we want to be aware of that. We want to be informed and proactive because that's going to be the best way for us to be prepared to use preventative measures to hopefully stop use from occurring with our teens, or at least delay the onset of use or deter from regular use. So a couple of common questions that come up for parents that I've heard a lot are, how do I know if my teen is using substances and it's becoming a problem? Or, what should I be looking out for? What should I know? So that's what we're going to kind of be talking about. Now, every child is different, but there are some general warning signs that can indicate substance use. And if that use is starting to interfere with their life in negative ways. Now, something to keep in mind as we go through the warning signs on the next slide is that just like not all substance use is the same and can fall on a spectrum, warning signs can also fall on a spectrum as well. Okay. So warning signs of substance use can be grouped into 3 categories, and recognizing these can hopefully help you in, detecting them sooner if they do start to pop up, and hopefully allow for earlier intervention. So let's start with the behavioral changes. So social changes. Okay, am I noticing that my teen is distancing from old friends? They're not hanging out with their childhood friends anymore. Are they getting a whole new group of friends? Now, I just mentioned, remember that warning signs are a spectrum, right? So a teen going to high school, it might be expected that they might change friend groups a little bit. It might be expected that they start to make new friends. So maybe that in itself, not, immediately concerning. It's something like maybe want to be mindful of, oh, their friends are changing, but that might be over here. But if all of a sudden, let's say they're really apprehensive to introduce me to their new group of friends, or I meet their friends and those friends are very clearly using substances, then that is when we can get to the different end of the spectrum, right? So again, that's why we have this bar here, just to remember that all of these can kind of fall in different places in the spectrum. Are we noticing changes in their mood or their distress tolerance? And I'm not talking about typical teen, having bigger feelings, but I'm talking about things that seem outside of their baseline or responses that seem very out of proportion to whatever the event or the situation is. Inconsistencies. So the way I look at inconsistencies is just that like things aren't adding up. Like stories, the reasonings they're giving for certain, when they're explaining something, it just doesn't totally line up. Something about it seems kind of off. If it seems kind of off, there might be something there, right? Inconsistencies, of course, can also include lying or omissions. Now, I will say that if you're noticing any inconsistencies when it comes to like finances, like them going through money really quickly, not holding on to it, or you're noticing money missing or anything like that, that's definitely going to be over here in this area when we start noticing any kind of problems with finances. I know that's, these are teens, but still, if they have a job or if they're asking to borrow more money more often, things like that. Increased secrecy. Again, teens want privacy. That's totally normal. I'm talking about more, all of a sudden they're like locking their door all the time. Or a big one that we actually see with teenagers is, are they taking really long showers? Are they spending a lot of time in the bathroom? Especially when we're talking about something like vaping, either nicotine or cannabis. A lot of teens will kind of use the smoke from the shower to kind of hide the scent, especially if there's a window in there. So something to be mindful of. But increased secrecy can also look like, let's say your teen used to come home from being with friends and they would come in after and they'd be like, oh yeah, it was fine. We went to the mall, we walked around. It wasn't a big deal. It was fine. Okay. And then they go in their room, right? They don't tell you all the details, but they kind of check in with you. And now all of a sudden your teen's coming home and it seems like they're beelining for their room. They're not really wanting to look you in the eyes. They're going in their room and immediately locking the door or changing their clothes or taking a shower. That's the kind of secrecy that I'm talking about, not normal privacy. Increase in risky behaviors, lying, stealing, sneaking out, missing curfews, going to parties. Again, spectrum, is this something that happened one time? Is this something that's becoming a pattern or we're noticing with other things? And then increased conflict. And when I talk about conflict, I don't just mean conflict with you and your child that you think might be using substances. I mean increased conflict in the home with other members of the family as well. If you feel like you and your husband or your wife or your partner are starting to have a lot of like arguments or bickering about what's going on, how you should handle what's going on, increased tension between you guys, that might be a sign that there actually is something more happening. Because if it's affecting the environment, it's affecting you guys, that might be a sign in itself. So let's move on to like functioning changes. So functioning changes are going to be things like changes in school, changes in hobbies. I put changes here for a very specific reason. I think sometimes when we talk about substance use, people think of like a decrease in functioning and a decrease in all of these areas. And although that is true, and especially if someone ends up developing a substance use disorder or becomes addicted to substances, we do see that. Sometimes with certain substances, you actually might see an increase in something, and the change might be an increase. So what do I mean by that? I mean, like with certain stimulants or with sometimes even opiates originally, you might actually see an increase in productivity, an increase in focus, an increase in grades before you see a decrease. Again, that's usually not sustainable and it will come down eventually. But again, it can be any kind of changes that don't really make sense. Like all of a sudden they're really proactive, productive and focused, but they haven't been doing tutoring or anything like that, which would make sense that, oh, their grades are increasing due to that reason. Um, Noticing changes in hygiene, mental comprehension, memory, like um, I'm feeling like I'm having, we just talked about this last night and you're not remembering that conversation, especially with someone who's smoking cannabis, short-term memory and things like that can definitely be affected. Or I feel like, why aren't you getting this? Like, I'm trying to break this down to you. It seems like you're not really getting it, but normally they would. So that could be some mental comprehension changes, sleep changes, sleeping more, sleeping less, worsening mental health symptoms. That's actually going to be a big one if your teen is reporting worsening in any of those areas. And then physical changes. So physical changes, I have first here changes to the eyes. I don't know what's that term, like eyes are the windows to the soul or something, but I do think that when it comes to substance use, eyes do tell you a lot. So like with cannabis, okay, are the eyes bloodshot? Sometimes with alcohol, they're a little bit more glazed over or like droopy eyelids. Pupils, are they really dilated? Are they really small? So anything like that, physically the eyes might change. Changes in like appetite, eating more, or I know this says eating more than usual, but could also be eating less, especially if we're talking about maybe like a stimulant. Now, I want to point out that if you're seeing any of these down here, then that is something that is cause for concern. And that's something that's definitely going to put us more in that red area. If you're seeing weight loss, nosebleeds that aren't something that they've always kind of struggled with, runny noses, increased sweatiness, jitteriness, and really reporting not feeling well, but none of those things also would none of those things make sense, right? Like there's no other kind of fever or cold symptoms or flu symptoms or things like that that would go along with it. Those are definitely going to be more concerning signs if we're seeing some of these physical changes and we're seeing them more consistently. So you all know your children, right? So when we're looking at these signs, I really want you to look at them in relation to like what would be normal for your child. If you have a teen that's never really been passionate about school, it's not really their thing, they've always kind of struggled with their grades and they're continuing to struggle with their grades, well, that's kind of consistent with how they've always been. That might not necessarily be a warning sign. But if you have a teen that used to be really involved in school and with extracurriculars, really motivated in those areas, and now all of a sudden we're seeing changes, that could be cause for concern, right? So it really is individualized. And, I'm not suggesting that these signs automatically mean that your child's using substances, but the more signs that we see, it indicates that something's going on, right? And whether it's because some of these signs, for example, you might see them if someone was experiencing maybe anxiety or depression, right? But the thing is that whether it's substance use, mental health, bullying, whatever it is, there's a need to check in because there's something causing concerning changes. And the earlier that we can check in, the better. So then, what can you do? What can you do as parents if you start to see some of those warning signs? So there is what we call risk and protective factors that can contribute to someone engaging in substance use or potentially developing a substance use disorder. Risk factors are things that increase potential risk of those things, and protective factors are things that can kind of decrease the impact of potential risk factors. They kind of act like a defense. So this whole first group that I have up here, I mean, really all of these, but especially here, are all going to be things and are examples of protective factors and things that you can do proactively before you even start seeing warning signs, but especially if you do start to see them. So the first one is going to be practice open communication with your teen. Be willing to have the tough conversations with them. A lot of it is about how can I start setting the foundation to have conversations, especially conversations around substance use or substances in general, so it doesn't feel so awkward, so it doesn't feel so like abnormal, and also so it doesn't feel really judgmental or like lecturing, because teens do not like when they feel like they are just being lectured and being told facts, right? So how can we approach these conversations in a way that feels organic, in a way that feels authentic? And one way that, parents can do this is really looking for opportunities. So I mean, one opportunity could be, oh, I went to this webinar today and this is what they were talking about. What are some thoughts you have on that? But it also might be you're watching a movie with your teen and there's a scene where there's a bunch of teens vaping in the school bathroom, right? So that would be a great opportunity either during the movie or when you guys are talking about the movie for you to maybe say something like, I can't believe that they were doing that they were vaping in the bathroom. That would not have happened when I was younger. That's just not something I would have experienced. Like, is that something that's actually happening at your schools? Like, is that something that happens at your school? So really kind of allows us to start talking about it in a way that doesn't feel so much like they're being put on the spot about their exact experience. And then you can kind of build from there. Like, oh, has that ever happened when you've walked into the bathroom? Like, how do you respond? Like, has anyone ever offered it to you? Right. So looking for that. And also really making sure that, even when we're addressing potential concerns, like if you are starting to see warning signs, that we're doing it from a place of curiosity, of wanting to understand, and really wanting to really engage in a conversation with them. Okay. I put here communicate with love. It's an acronym. This is something that I actually got from the Center for Motivation to Change. And it stands for, it's kind of like a good reminder when you're talking to someone. It's like listening, offering, validating, and empathizing. So when you're having these conversations, you can kind of check in with yourself, like, am I doing these things? Now, the next two things I have here are parental monitoring and then providing clear and consistent messaging. So parental monitoring, this is going to be the who, what, where, when, why, right? Like, it's really important. And this is a really big protective factor against teens using substances, of, knowing what my teen is doing, knowing who they're with, knowing what they're up to, where they're going, all of those things really important. And also providing clear and consistent messaging. We want to make sure that we're being clear with, what the rules are, what the expectations are, and also that we're being consistent with that. And so that's also why it's really important that whoever the decision makers of the family are on the same page, that you guys together are giving clear and consistent messaging, because we can get into a little bit of murky water when that's not happening. And then also the last one I have up here on this section is staying informed and seeking information. I mean, what you guys are doing right now is amazing. I'm sure you're here because you care and you love your children and you want to be more informed. So continuing to do things like this is going to be really helpful. And then what if there is more immediate concern? So let's say you're seeing some of those warning signs that were a little bit more in that red zone, or you're seeing more of them, or let's say you've really been trying to practice the communication and it just seems like it's still not getting through. They're not being receptive to that. Here's some other steps that you can take. First and foremost, reaching out to your child's primary care physician, ask questions, share concerns. They're going to be like a great first resource. Reaching out to a therapist or a counselor, even if this is as a more preventative measure. Again, if you're seeing warning signs, regardless of the reason why they're happening, it's an indicator that something's going on, and getting support can be really helpful in addressing, the underlying problems or concerns, regardless of what that cause is. And hopefully, if they are speaking to someone else, you can get a little bit more information and get to the bottom of what actually is going on. Another option is consider administering home drug screens. So let's say, again, you feel like something's really going on, you're seeing warning signs, you're really concerned. Maybe you have caught them with substances before, or maybe you are again, really trying to ask them, trying to do it in a non-judgmental way, they're continuing to deny, but you really feel like something's going on, you can consider administering home drug screens. Now, if you are wondering, okay, what would that even look like? How would I know if I should do that? What kind of steps should I take? Is there anything I should keep in mind if I am going to do that? We are actually creating here at Evolve. I'm working with the company to sort of create some guidelines, a whole parent resource page regarding drug screens, and that's going to be up shortly. So you can definitely keep an eye out for that. I think we're going to be able to send out some information regarding that in the future. So that would be a great resource to eventually use if you have any questions on this area. And then the last thing I have here is, again, if you're seeing those warning signs and there is more immediate concern, reach out for professional evaluation. Like, for example, you can call a place like Evolve and speak to the admissions team. You can ask questions. They can assist in setting up an evaluation or helping support in identifying what kind of level of care might be appropriate. So all of these things really do play a powerful role in really helping to establish, a secure attachment for your adolescent, and really help in kind of just setting them up for success, setting your teen up for success. So we're getting ready to close out, but I have some resources that I want to just mention. So all of these book options up here are all going to be books that kind of look into building up that parent-child relationship, that secure attachment that I was talking about. I have here this marijuana facts parents need to know. This is on the NIDA website. This is a great resource to look into. It has information on just marijuana in general, how it affects the brain and adolescence. It also, I think, gives some tips on how to talk to your teen about marijuana use. So that's a great resource. I have here another one from the DEA website that's called Emoji Drug Code Decoded. It's a little bit of a mouthful, but this one is really great. Basically, what the DEA did is that they created a list of all the different emojis that that also can be used for sort of like secret kind of code words for different substances. So it gives you a whole breakdown of the different substances and what emojis might correspond with that. Like, for example, it might show you that a snowflake might mean cocaine. Right. So for a parent, that is going to be, I'm going to, really encourage you guys to take a look at that, because if you're seeing certain emojis or certain things popping up and you're like, that doesn't really make sense there, maybe that it could mean something like that. And the next thing I have here is some family mutual support options. So this is going to be more for families where maybe, let's say, your teen is in treatment, has been in treatment before. Maybe they do have a substance use disorder. They are struggling with addiction. We talk a lot about having the importance of people who are struggling with addiction who have substance use disorders, having that community support. And we don't always think about that there's actually a lot of resources for family members there as well, because if you're in a situation like that as a family member, you're probably going to have been very affected by the situation as well. So here are two options for mutual support for family members. Al-Anon is going to be the kind of 12-step equivalent, but for family members. There's also like Nar-Anon or Families Anonymous, but they're all going to follow the very similar kind of 12-step model. And then the one on top is Smart Recovery. Smart Recovery is one I'm very much a believer in. I am a trained Smart Recovery facilitator. I really do believe in it. It stands for Self-Management and Recovery Training. It's all evidence-based, based in science. We use it here at Evolve. So if you want to know more information about it, you can ask me here, but also you can go ahead and take a look at their website. But they have a full Smart Recovery Friends and Family program. So it's a very tool-based program. So they have different tools and worksheets and community meetings and all sorts of resources for families. So that's a great one to look at. And the last one I have here is just some information on Narcan. So I mentioned um, in the beginning that we're unfortunately seeing those increase in fatality rates amongst just in general. That's one of the trends we're seeing. So Narcan essentially is a life-saving medication that reverses the effects of opioids and opioid overdose. You don't need a prescription to get it. It's available at most places. And I'm a really, strong believer in, certain at-risk populations having it as a sort of safety measure. And I think the teen population is an at-risk population. So if you're interested in learning more about it, getting more information or seeing, where you can maybe get it, that's something that I would encourage everyone to take a look at. So yeah, that is it. That's kind of, we're wrapping up the content portion. So now we're gonna go into questions. I'm gonna stop sharing my screen in a moment, but if anybody does have a question that you want to ask, we have, about 10 minutes. I'm happy to try and answer some. And also know that you can submit questions anonymously as well. So if you want to do that, that's definitely an option too. So I know it's kind of putting you guys on the spot, so I'll give it a couple minutes just in case. And I'm going to stop sharing my screen just so I can see the question box for everyone. And I'm going to open the Q&A. Okay, so I see an anonymous question. Okay, so let's see. Okay, so the question is basically asking, oh, this is a good one. Okay, so any advice for parents that are not on the same page, how to address concerns with substance abuse? And I just got to say, first and foremost, I really feel for you. I think that's a really challenging situation when you and the other, maybe let's say, parent or other guardian in this situation, maybe there's not agreement on how to handle the situation. And also I'll say that I think it's actually really common that typically one parent that their son tends to be a little bit of a discrepancy. So what I will say is that something that could be really helpful, and of course this has to do with both parties being willing, but I would actually really suggest, even if the situation, the parents aren't together anymore and they're divorced, I really would look into having a conversation with some professional support, with some professional advice. So a counselor, a substance use counselor, to really work on getting the same page, because one of the biggest things that we actually want to avoid when we are is going to be the teen getting mixed messaging, because that can lead to something we call splitting, which can involve sort of the teen kind of aligning with one parent and then making the other parent the bad guy, or maybe they present differently with one parent than the other parent, and so it can really get in the way of making positive change. So that would be my suggestion, even though I understand it can be really challenging, is like, is there anything that we can do together, someone we can talk to, even if we're divorced, to get on the same page about this so that we can be a united front on this? And because part of the work with someone else might be able to get to the reason on why you aren't on the same page. Like, is it because that other parent is like, well, I used to use it, or I know people that used it and it wasn't a big deal. Okay, well, maybe then they need some of that psychoeducation about how the substances have changed, right? And sometimes getting that outside person, that outside perspective, rather than just the other parent giving information, they can hear it, they can be a little bit more receptive to it. So that's one thing that I would try. Okay, so I see another question here about what common drugs does Narcan work on and where do you get it? Okay, so Narcan only works with opioids. So that's actually really important to know, because let's say a teen is there is an overdose. I mean, anyone could be experiencing an overdose, but let's say it's from Xanax. If you were to administer Narcan, it actually would not reverse the effects. So it really specifically is going to be for different opioids. Now, one of the great things about Narcan is that there hasn't really been any reports of it having adverse side effects. So let's say you thought someone was experiencing an overdose and you didn't know what they had taken, you could administer Narcan. And if it was an opioid, it will help in reversing that effect. But if it wasn't an opioid that they take, it won't reverse it, but it won't harm them. So that's again why I think it can really be life-saving, why I recommend a lot of people having it, because it's sort of one of those things where again, it is for opioids, but there's not going to be an adverse side effect if you give it to someone and they didn't take that. As far as where you can get it, you can get it at most drugstores, get it at any pharmacy. You can order it online even. And I'm not sure if that link I gave had resources to it, but most places you can go and get it. And again, you don't need a prescription for it at all. Okay. I see, okay, let's see. Another question about dealing with substance abuse with a co-parent and a teen, but with the parent not being on the same side. Again, I feel for that. I know it's a really challenging situation. Again, I would say, is there anything that you guys can do, or a person you guys can go to try and get on the same page, find out what that barrier is that's keeping you guys being on the same page? I know that's not an easy answer, but that's going to be the best case scenario is going to be both team members, both parents, even if it's a co-parent situation, approaching it together and also deciding together what that's going to look like. There might be compromise on different ends on what that's going to look like, but either way, being like, how can we get on the same page? Let's see, do they have any smart recovery settings in New England or the East Coast? Yeah, 100%. Smart recovery is all over the world. It's all over the world. So East Coast, there's some, I know for sure there's some in England, in Europe. So yes, if you go to that Smart Recovery website, you'll be able to look up, I think it just says meetings, and there'll be a drop down. Again, there's two different programs, right? So there's the regular Smart Recovery meeting for individuals who struggle with addictive behaviors. And one of the great things about Smart Recovery is it's not just for substance use. So let's say you have a child that is struggling with gaming, or they struggle with self-harm. Smart Recovery works for that too. And also for family members, you guys would be able to go to the friends and family meetings as well. It's for any addictive behavior, but they are all over. Oh, I'm seeing the time, but I hope you guys, I'll try and go by, let's go through faster. I don't know if our moderator needs to jump in. Let me know if I need to wrap up. Let me know. After yes, from CVS, is this common? Yes, unfortunately, we are seeing there is a lot of teens that are resulting to taking things such as over-the-counter medications in an effort, because oftentimes because it's easily accessible. So yes, it's common, unfortunately. And it's a way to kind of try and get a high on something that's more easily accessible. And that can be kind of challenging because it also doesn't show up on all drug screens too. So that's something that can make it a little bit more challenging to catch. Okay. So I'm seeing someone here. Okay, so basically this question is asking, what if there's a teen that's really depressed? And it's sort of this idea of, well, what if we'd rather her smoke than we hurt herself? And I think that also is very similar to someone saying like, okay, well, I would rather them smoke, nicotine or, marijuana rather than them doing heroin. Right? Like, oh, or doing these other pills or something like that. And so this person is saying, like, we're open to monitoring it. Like, what are my thoughts on that? So I guess I have a couple thoughts on that. So first and foremost is just that, like, it's complicated. I think something having less risk, or if a parent thinks that there's a less risk doing one thing versus another thing, I just want to make sure that we're aware that less risk does not mean no risk. Okay. So I think it's always important to kind of acknowledge that. and be really honest with ourselves about that and about the potential side effects. So even if we're talking about something like cannabis, I completely understand, or it says smoking. I'm not sure if you mean cannabis or nicotine. So I guess that would be a question. But especially when we talk about cannabis smoking, that actually does have some correlation with worsening mental health symptoms, as well as potential of, in some cases, in people who already are more vulnerable to like psychotic symptoms or bipolar disorder, schizophrenia, to experience those adverse side effects from smoking cannabis. So I think, I can't give a specific answer because I don't know the case, but I would say that we just want to be mindful of that. And then the second part of it also is that, yeah, I'm not saying here that smoking cannabis or nicotine is the same as smoking heroin. I'm not saying that at all. I think when we go into is this better than this? The way I always look at it as less risk does not mean no risk. And also then we're getting into what's called harm reduction. And harm reduction is all about kind of safety first and how can we reduce risk. And I do think that there are benefits of that at times, when we're talking about a teen coming in with maybe, they've been using a lot of stimulants or they've been using a lot of opioids and they're, hey, I'm willing to stop using this, but I'm not sure about stopping to use the nicotine. Okay, then that's definitely some time where maybe we would want to look at taking a harm reduction approach to that. My recommendation, though, with this or anytime you're using harm reduction is that you're doing it with some support of a professional, so a substance use counselor or a therapist, so that can really look at the case and really provide some support on that. Make sure we're doing it as safely as possible. Okay. I'm asking someone wanting to look at the THC page again. I think you guys are going to actually have access to these slides. So I think afterwards you'll be able to definitely take a look at that. And then I see another question about smoking weed in moderation, like once a month at a party or something. Is that okay? Now, again, like that's so hard to say, is it okay? That's not necessarily for me to say. What I would say again is just that. And again, are we talking about an adult? We're talking about teens. It's not a one size fits all situation. What I would say is that if you know that use is occurring, then you definitely, even if it's what you would consider, let's say, experimental use or moderation use, that especially as parents, you guys are on alert about that, because again, any use is going to have consequences or potential for consequences, and any use could lead to negative side effects. So my always thought is, if we can avoid anyone using any substance or prolonging when they start using, that is going to be the best thing. That is going to be the safest, right? And also, I understand, like I said before, that like experimentation or curiosity is going to be a part of the conversation. So I think making sure that you're really leaning into those other protective factors, that you're really leaning into the communication, that you're really, again, being honest about the situation. Because again, it's not about me saying, is something okay or is it not okay? It's just saying, there's risk and there's going to be risk. So again, if you start seeing any of the warning signs we were talking about, we got to be really mindful of that. Okay, two more. Let's see. This is for months. My daughter has this consistent cough for months. Could it be a sign of vaping, nicotine, or cannabis? Yeah, I mean, again, I'm talking in very generals in these situations because I'm not talking about specific cases. But yes, there some of the side effects of smoking or vaping, whether it's cannabis or nicotine, is chronic coughs, as well as things like increase in like phlegm or bronchitis or things like that. So again, I can't say for sure, but yes, that could definitely be a sign. Okay, should I worry that my daughter takes hours to respond to text messages or calls on a regular basis, even though I know she is never without her phone ever? Yeah, I mean, should you be concerned? I mean, as a parent, I think there's always going to be probably a little bit of concern, right? Especially if we're trying to get a hold of our child and we're not able to do so. I think my biggest question would be, is this something that has always kind of been the standard with her? We've talked before during the presentation about baseline, right? Baseline is like, what's that standard behavior? So is this someone that's always been pretty bad at texting or responding? I have some friends who are maybe like that. Or is this seem new? Does this only happen when she's out with her friends? Then yeah, I think that could be concerning. And my recommendation would be to have a conversation about it. And also, again, going back to those clear and consistent messaging, being really clear about what the expectations are, what the rules are when she is out with her friends. But again, when we bring those things up, we don't need to bring it up in sort of a accusatory or angry way. We can communicate with that love, right? We can just say, hey, this is something I'm noticing. I love you. I care about you. I just always want to make sure you're safe. This is what I would appreciate moving forward in the future, right? And we can approach it from a way that feels supportive and like you want to give them their space. And also at the same time, this is what I need from you. Okay. Okay, I think we got through all the questions. Sorry, some of them were, it's powering through, but I just want to say I appreciate everyone being here. I appreciate everyone who did submit a question. And again, I do think these slides are going to be available afterwards. And again, we will be sending, I think, out an email down the road when we do get that drug screen page up and running, in case that is something that you're curious learning a little bit more information about. Okay. Well, thank you guys so much. It was so nice being here with you guys tonight.